Gentlemen, my name is Giridhar and I am from Azim Premji Foundation. I think I met some of you a couple of months ago when we had Harsh Mandar's talk, and that was about his book. Today I am delighted to welcome Mr. Amarjeet Sinha here. Amarjeet, would you please? Education, Government of Bihar. A dear friend of ours for many years, and I remember when I joined the foundation probably in 2002, one of the first IAS officers that I met to know more about education systems in India was Amarjeet at Delhi at that time. Amarjeet is a prolific writer, and I always wonder how in his hectic 24/7 administrative leadership he finds time to write, but he's a prolific writer. 1996, the Probe report, many of you may remember, which is an acronym for Public Report on Basic Education. One of the people who steered that and wrote that was Amarjeet Sinha. Amarjeet's been involved in two very important inflection points in our development history in the country. One is the Sarva Shiksha Abhiyan, and the other is his tenure as the director of the National Rural Health Mission. He's been with the government of Bihar back there in his parent state for a couple of years now. Without taking much of your time away with Amarjeet, I'll move now, but I'll invite Amarjeet to speak to us. Amarjeet, you can take about 50-60 minutes to speak, and then we'll throw it open to questions. So if we're starting at 6:10, maybe by around 7-ish, and then question and answers. Over to Amarjeet. It's a great pleasure, and welcome once again.
Thank you for that rather generous introduction. It's a pleasure to be in Bangalore, and I'm grateful to the Azim Premji University for this opportunity to share some of my ideas with citizens of Bangalore. Friends, it's a little unusual to write on the subject. Unusual not because the name that the book carries, but the message that the book tries to give. An India for everyone, a path to inclusive development. Every document of the Planning Commission, every government irrespective of its shade, every provincial government irrespective of the political power, they've all been talking about inclusive development. They've all been talking about equitable society. Where the book makes a couple of departures, and which I'd like to flag right in the beginning. See, post 1991, we live in an India where the assumption is that the high rates of growth that we could reach was on account of the deregulation, was on account of the delicensing, was on account of an enhanced role for the private sector in fostering economic growth. Agreeing that that has been a case, opening up was good for economic growth. Opening up was good for larger and higher rates of economic growth. The point, and the foremost point which I have tried to make in this book, that what holds true for economic growth may not necessarily be the right path for human development. The point that the book makes is that we cannot visualize an inclusive India, an inclusive society in India, without human development as an entitlement of every citizen of this country. Ultimately, what makes a difference between accidents of birth and fulfillment of aspirations is education, health, nutrition, an ability to be able to fully develop one's human potential. Friends, there can be no inclusive society or inclusive development in the absence of these opportunities, irrespective of the accidents of birth. It is for this reason that across the developed world and the developing world, human development has been a priority, not only as assertions of political systems, but often backed by huge financial resources. We have the case of the continental Europe, France, UK, Germany, we have Canada, a whole lot of countries. When we look eastwards, we look at Thailand, we look at China, we look at Indonesia, Japan. Across the world, human development seems to have played a major role in determining the trajectories of nations. We in India have also aspired to higher trajectories, but one of our fundamental weaknesses has been our inability to address the human development issue as it ought to have been. The point that this book tries to make is that there is no going away from public systems and credible public systems if one really wants human development to be the kind of priority that we are talking about. While partnerships with the non-governmental sector are welcome, are needed, are required, the kind of role that the Azim Premji Foundation plays in strengthening systems of governance, in strengthening capacities to manage public systems better in the education sector. But having said that, there is really no going away from strengthening public systems to deliver quality services. This book was released by Professor Amartya Sen in Calcutta in February, and I recall just before the release session, we had Professor Sen. There is this Kolkata group where about 40-45 of us meet every year to discuss a few issues in human development. It's a diverse group, and when we are discussing, and as is the case, the first session is normally Professor Sen talking about human development and its importance, gender, education, rights of vulnerable groups. In that context, I remember having raised an issue with him that Professor Sen, you've been rightly making the case of human development, of more public expenditures on education, health. But in India, one of our difficulties has been that not enough good evidence-based research is available on what makes public systems deliver better services. If you are in UK and looking at the health sector, the NHS has been studied by the best of universities, and good studies are available to make corrections in public policy as and when required. If you are in France, you are in Germany, you are in Canada, any of the countries, wherever public expenditures have been assigned for human development, there is an ongoing process of academic research, evidence-based research on a large scale by the best of universities to guide public policy, what fundamental changes are required to make systems deliver better services. In India, unfortunately, while a lot of very good academic work happens, but when it comes to studying public systems of education, health and other systems, oftentimes the kind of evidence-based work that we are looking for is not very readily available. A lot of the debates have continued to be in the realm of ideology, have continued to be in the realm of positions already taken, even before we have looked at the evidence very carefully. When I raised this question, Professor Sen's immediate retort was, Amarjeet wants academics to become administrators. I clarified that was not the intent. The intent was largely to say that administrators needed to be guided in shaping public policy on the basis of good evidence-based work. Friends, this book has attempted to do that. In a manner, the book has been a double jeopardy. A double jeopardy because it was first written as a 500-page monograph, and the first comment which I got at home from my wife, who's going to read your book? I didn't take it very seriously. I still took it to the publishers. And the Harper Collins team said, we are very happy with what you have put together, but this is not the form in which we want it. We want a paperback which anybody is willing to read, not more than 50,000 words, and it better be readable. Besides the monograph, which was returned to me, I was also given a set of 5 or 6 books and told that this is how you ought to be rewriting the entire book. So the book had to be rewritten before it finally saw the light of day. I'm happy that they put me through this strain, because it was difficult, because writing as it is takes time, but when you rewrite it, it is even worse. You're not sure what you need to keep and what you need to keep out. Anyway, as often happens in governments, I thought this was now impossible because I had been given very important and very time-consuming assignments when I returned to my state of Bihar after about 17 years as the health secretary and later as the education secretary. I thought this is going to remain in a draft form for some years, till this opportunity came in the form of a 5-week training program for IAS officers of our seniority, in various universities and the Mussoorie Academy. All I remember of those 5 weeks is my laptop and the rewriting of my book. It provided the time to be able to revisit and write what had been intended. Friends, the book, as I was trying to explain, looks at various aspects of public systems. It does not make a case for moth-eaten public systems. It doesn't defend moth-eaten public systems. It doesn't defend the public system that perhaps many of us have been victims of. Paying a tax, applying for a license, whatever it is. But the point that it makes is that when we look at the human development sector, across the world, irrespective of the ideology followed by those nations, public systems and public expenditures have had a very major role to play. Therefore, not to attend to it on account of this very false notion that in India post 91, privatization is the answer to all ills and problems. Unfortunately, that solution doesn't lie here. The argument that the book makes is that it is no rocket science to have public systems that deliver quality services. How does one go about recrafting public systems is what the book accepts as a challenge and tries to relate in the context of what has worked in various parts of our own country as also in various parts of the world. A lot of the reform that the book really argues for has to do with recrafting public systems to deliver quality services. Because ultimately, I know that there are many points and counter views on many of these issues, but what we often forget is that if we were to aspire for a health system like the United States of America, we better keep aside 17% of the GDP now and 25% 7 years later. That is the cost in terms of not only public expenditures but private expenditures also on health in that country. The continental models come for about 8% of the GDP public expenditure. The large countries like Brazil, whom we like to be compared with, Brazil, China. Brazil spends about 8% public expenditure of the GDP on health and about 4.5% on education. China was spending very little on health, barely 2% GDP, till they realized that they really had a major scare if they did not invest adequately. 2 years ago, they've started off a $100 billion program to strengthen public systems of healthcare in China after carrying out a lot of experiments before that. The point to be made is, whether it is Thailand, any government, any form of democracy, any form of non-democratic government, public systems seem to be the answer to a lot of our requirements for human development. The critique of the public system, there can be, one is the issue of service guarantees. How do you ensure that citizens get the service or entitlements of citizens are honored by a system? What is it that needs to be redone? A lot of fundamental changes have been advocated in this book, whether it is with public recruitments, whether it is with public management skills, whether it is with the legal entitlement, whether it is to do with the accreditation and assessment of systems. So while trying to look at the failures of the public system, I also chanced to look at some systems in our own country which seem to have withstood the crisis of the public system, so to say. And one of the most glorious examples turned out to be the conduct of elections in India. If we have survived as a democracy, it's because of an election process that the rest of the world wants to emulate and copy. How is it that we are able to displace the most powerful governments through the ballot? And how do we go about it in a fair, transparent, and functional manner that every citizen is able to exercise the authority and the right to vote? While looking at that system, we realized that when we conduct elections, we don't leave anything to chance. We do the last mile planning for the election process, from the training of personnel to ensuring their mobility, to ensuring certain systems and allocation of responsibilities, to sharing a system of a public relationship where everything is available in the public domain. On the other hand, when a case is made for employment for the poor in the name of Narega, what do? We let the same moth-eaten block development office implement that program without even looking at how that system needed to be recrafted. Large number of states where the institution of the block development office had collapsed because of lack of reforms, and this is again an area we need to look at, because one of the arguments the book makes is that India was essentially the colonial state, was a regulatory state. The colonial state had responsibilities of public order. The colonial state had responsibilities of revenue collection. That regulatory state, we now want it to become an instrument for development without fundamentally changing a lot of the character of that regulatory state. Now, if education, health, nutrition, and other human development entitlements of citizens have to be honored, we need to revisit a lot of the framework for governance that we have adopted for ourselves. If we don't do that, it is likely that we'll continue to do a lot of with mindless last mile planning, not worked out exercises, where the intent may be to change fundamentally the way society works, but the outcome may be something very different. As has been commented by many chief ministers, that a large number of these employment programs have meant a larger number of boleros with the mukhias and sarpanches of Panchayati Raj institutions. I make this point because ultimately, when you do not have good evidence-based research on a whole lot of these parameters of governance, the positions that we often take are ideological rather than need-based. Let me illustrate by another issue that I have dealt with at some length here. I am all for local government, Panchayati Raj institution, the Constitution of India, 73rd, 74th Amendment. Some of you may have read George Matthews' impassioned, emotional plea today in the newspaper in the Times of India on why local governments must succeed if India has to move forward. I have no quarrels with that. But look at the evidence and the implementation. After all, a lot of thought had got into the Indian Constitution to keep the judiciary, the legislative, and the executive as clearly separate institutions. What is happening in the local government? In the Panchayati Raj institution, the elected representative has become the monopoly executive functionary. In the sense, all works have to be implemented. Rather than the elected representative of the community at that level, the elected representative has been made the executive functionary as a contractor of all works. Now, this needs, I have all the regard and respect for the elected representative at that level, but then an MLA or MP does not carry out executive function. Their job is policy making. At the local level, therefore, in our country again, often the debate is polar. Either A is right or B is wrong. Something which is always polar rather than looking at the evidence. On local governance as well, what is the problem in community organizations not having a role in the partnership with PRIs? And when I refer to community organizations, they may well be self-help groups of women, they may well be Mahila Samakhya organizations, they may well be school committees. The reason why we need to link them up with the PRI institutions is because, again, a fact which we often miss so easily, 60% of India's villages, the population is less than 1,000. Which means that what we call a Gram Panchayat for 5,000 population, which in many states today, in Bihar for example, it's about 14,000 is the average population of a Gram Panchayat. It means about 10 to 20 habitations fall under that area. There are 20 different habitations, maybe 15 different schools, all under one Gram Panchayat. Now, if we had community organizations at the habitation level, working closely with the leadership of the Panchayati Raj institutions, then clearly the monopoly of executive functions would not have been there. Rather than seeing community organizations as blasphemy for PRI or local governments, we should see it as an organic partnership, and then the accountability question naturally will get revisited. There are examples from our own country where programs have worked well, which have respected the habitation level leadership. A very good example is the Mahila Samakhya program, which many of you may be familiar with, which aimed at creating a cluster of women at the village level. Now here again, the Mahila Samakhya program made 2-3 departures. Rather than using gender as a unitary principle, a school committee, one woman, one man, one SC, one ST, it didn't work like that. The Mahila Samakhya program organically created a collective of women at each village level. And that collective of women, the Mahila Sangha, at other levels similarly, had other arrangements. It was a highly process-intensive program. Professionals were drawn in from outside the government setup. The best of professionals paid a decent salary, were brought into the system to work with these collectives of women, and there we see the difference. The point I am trying to make is that program worked with habitation as a unit and not a Gram Panchayat as a unit. Given the fact that 60% villages have 10 to 20 habitations and hamlets constituting a Gram Panchayat, we needed to understand this better. In a Kerala village, the local government at the Panchayati Raj level can work very well because the villages are clustered, 10, 15, 20,000 people living together. It's possible that the PRI is able to fully represent the aspirations of each and every household and community. Whereas when you have 20 different habitations at different levels of development for organizations of different principles, it is likely that partnerships of community organizations with the local government system may have worked better. Similarly, on public recruitments, one of the criticisms of people in government, and rightly so, that it's more difficult to be thrown out of government than it is to get into government. Because the processes and the constitutional safeguards being what they are, very difficult to throw out somebody from government. I am not trying to advocate for a casualization of employment in government, but we need to seriously relook at what public recruitments are we offering at the moment. Some reforms in the National Development Council's agenda with regard to human development, because public service commissions are constitutionally mandated and they have served a very important purpose of recruitment beyond a certain level in governments to be cleared by the public service commissions. They have played a very important role in ensuring quality, excellence, and a certain commitment to fair and transparent recruitment in governments. A time has come where we needed to revisit both the skill sets that we need in governments as also the permanence that we will assign without any performance rating, without any performance assessment. While the public service commissions have played a very good role in selection of candidates, often, of course, there have been issues with regard to the time frame within which it happens. But the fact that we've reached a stage where if we want to do education, health, nutrition, and other human development entitlements of citizens, we need a different set of professional skills in our government. Rather than recruiting magistrates, we may as well need more managers. Now, have we thought through this process of having better skilled people with a completely different skill set in governments to manage programs which are essentially for ensuring entitlements of citizens? Wherever this has been experimented, the results have been positive. Offhand, I can share the example again in the health mission. Most of the states went to, because there was a provision at block level in the hospitals, in the for health managers, hospital managers, district program managers, Tata Institute of Social Sciences, Institute of Health Management and Research, Jaipur, whole lot of other institutions. Batch after batch got recruited in many states as health managers at the district level. If one does a good evidence-based study of that, a lot of the change in the health system in some of the states can be attributed to new professional skills in the system. A master's in computer applications in all the 543 districts of the country at the district level makes a difference to the kind of MIS systems that we design and work upon. Chartered accountants and cost accountants and intercharters as district finance and district accounts managers bring in new sets of skills to manage financial resources of a different order. The case which is being made in this book is that we need to revisit skills that we recruit in government. We need to redefine public recruitments where performance again is taken into consideration. Let me illustrate the point that the book makes through an example from the education sector, because Azim Premji University has been engaging in the university education sector. Two examples. We are all aware, and we keep reading in the newspapers, state after state, there are agitations of teachers, what salary teachers ought to be paid, how they ought to be selected, how they ought to be promoted. I remember a debate again, Professor Amartya Sen and Jean Drez were releasing their last book in Delhi. And Praful Bidwai was in the audience, like a book release function like this. And I recall one of the questions which he asked Professor Sen, that Professor Sen, have you not legitimized para-teachers? The answer which Professor Sen gave was a very interesting one. He says, in the long run, I cannot disagree with you, because if I want a good teacher, I ought to pay the teacher well. But unfortunately, in the short run, the evidence has been to the contrary. The Pratichi Trust, which Professor Sen had set up with his Nobel money, Bengal and Bihar, they did a study of so-called panchayat teachers and also regular teachers. And the findings were very shocking, that many of the locally accountable panchayat teachers seem to be doing more than many of the so-called full pay scale teachers that were available there. The point to be made here is that again, if we go by the evidence, a lot of revisit and reconsiderations are possible. There was again, often what happens is when we don't look at some of these careful studies very carefully, we often make the same mistakes over and over again. There was a very interesting program in Rajasthan in the early 90s called the Shiksha Karmi project. Very innovative in the sense, it began by a realization that there are these 10 to 15% schools in Rajasthan where no teacher goes to school. And they decided for these 10 to 15% villages, they acknowledged that yes, this is the problem. They said from the village itself, these were many tribal pockets in Kotada and other blocks in Udaipur, in some parts of various Jaisalmer. What the Shiksha Karmi project did, they said we'll have local teachers. Now again, they selected local teachers through a process. The Gram Panchayat was asked, please find out men and women in this panchayat who are 12th pass or 10th pass, who are willing to teach children. We are willing to consider their case. So Gram Panchayats came up with their own list of 7, 10, 12 people that they ought to be made teachers. Now there was a professional group with non-governmental organizations and others on that committee, which formally interviewed these candidates who were nominated by the panchayat. They selected on the basis of whatever assessment systems that they had designed. Interestingly, many tribal women who were 7th pass and 8th pass also became teachers, but they were put through a very rigorous program in what were called Mahila Shikshan Kendras, which were run by NGOs in these pockets to train them to become good teachers. The Shiksha Karmi was the first program which said, look, we may recruit them at 2,000 rupees a month, but if these teachers successfully complete 8 different levels of assessment, they can actually earn as much as a regular teacher. 10 years later, when the program was closing, more than 46% of the Shiksha Karmis had actually cleared all the levels and were earning as much as a regular teacher. Here was a good performance-based system. Now again, though it seems a small little issue in public recruitment, the panchayat could give a pool of persons who were entitled to become the teacher, but there was an expert committee which decided who among them should become the teacher. In many states, what has happened is, the panchayat was told, you appoint the teacher. There have been instances where panchayat was told, whoever has the highest marks, you have to appoint as a teacher. There have been instances formally recorded, where if the Sarpanch wanted to recruit X, the Y and Z who had higher marks than X, their applications were torn and thrown in the dustbin, so that X could be appointed a teacher. Again, I am making the same point, that an elected representative cannot be the agency for executive functions. While they have a very important primary role in determining how we set up our systems, recruitments are professional business. They have to be done professionally. Again, you cannot think about it ad hoc. What most states thought panchayat teachers to be, oh, here is a means of low-cost teacher availability. Whereas it had to be seen as a local teacher being developed over time as a good, skilled, trained teacher. The training program for Shiksha Karmis in Rajasthan, they worked on the assumption that these are local boys and girls who have opted to teach. We need to work with them systematically. 40-day training programs. I've had the pleasure of sitting through the 40 days of one such program, where the assumption was that they need to be supported to be able to teach better in classrooms. A whole lot of other teacher programs which have come in later work on the assumption that the teacher already knows. We need to teach them theories of teaching, theories of education, some theories on pedagogy, and that's all right. Whereas in the Shiksha Karmi program, the assumption was that the person doesn't know. So each and every chapter of the textbook, systematically, it was gone through. These may appear very small instances, but this is what evidence-based public recruitments for public systems is about. Similarly, assessments and accreditation. Many a time, reform in our country always begins at the top. Somebody says assessments is a bad thing in education. Everybody else says, no, assessments is a bad thing. Shall we do assessments? In all humility, I would only like to say that if public systems have to be accountable, we cannot keep accreditation and assessment out. Whether it is a private sector or a public system, it ought to be assessed whether or not it is carrying out the functions for which it has been established. Whether it's a health center, whether it is a school, we ought to know whether or not they are providing the kinds of entitlements to the children or to citizens in a hospital which they are expected to. Now, I think a lot of the reform of public systems has to be about getting it the right skills, giving it the financial autonomy to take decisions. A hospital cannot be managed by a director of health services deciding which medicine at what time and for which patient. Level of autonomy has to be different. It has to be institution words. Public systems to deliver quality services will have to move from distrust to trust. Have as accountable a system as possible at the institution level, but ultimately you will have to begin to honor the autonomy and the leadership of the medical officer in charge of a primary health center or the headmaster of a school. I cannot expect a headmaster of a school to be the character builder of my child and not trust that headmaster even with a 10 paise test tube to be bought. So a lot of reform in government is also about procurements. It is not that every time the intent of governments is to make wrong procurements. So many of the basic skills of procurement as a discipline itself is a professional discipline. Large scale procurement of machinery for hospitals. Many a time the corporations are not aware of all the processes that need to be gone through. Now here again, the point I've been trying to make in our own country, look at the Tamil Nadu Medical Services Corporation in Tamil Nadu. An exemplar organization set up decades ago, continuing to give guaranteed quality services in procurement of medical equipments, drugs. Now, rather than emulating and setting up similar systems in the other states, we seem to be moving around gyrating all kinds of nonsense without looking at the evidence as carefully as we need to. Luckily, over the last 7-8 years, we find many other states, including my own state, Bihar, Rajasthan, they are all moving towards systems of procurement like the Tamil Nadu Medical Services Corporation. It is not that good practices are not available in our own country. I mentioned about more professionals in the system. The Velugu project in Andhra Pradesh, again a project which has been very contentious for many reasons, because the panchayat felt that they have not been assigned a role. The project felt that it needed professionals to work with self-help groups for them to be able to market a lot of the produce that they make, as also for running their programs better. The Velugu project in Andhra Pradesh, and also a very similar project in my own state in Bihar with the women, the self-help groups, which is doing extremely well. A large number of professionals have been recruited at each level. There are graduates from IRMA in large numbers in these states who have chosen to work in district teams. Couple of good MBAs from good institutions are also working with these organizations. The argument clearly is, if you want public systems to deliver quality services, your professional team ought to be fully equipped to the challenges of that, ensuring that entitlement. Friends, whole lot of issues, not only from our own country but other countries. But again, some evidence we always fight shy or feel shy in presenting in the form that it is in. let me take the example of education, primary education, which is a matter of concern for all of us. And if each time that the Pratham Asar report comes out, we really squirm, what is this? Public systems are declining further, children are not learning enough. I had the privilege of being part of the public report on basic education team with Jean-Drej, Shiv Kumar and others, and we did the survey in 1996. We looked at 5 states, which were the so-called Bimaru states, and we also looked at Himachal to try and understand what works and what doesn't. 10 years later, in 2006, we did a revisit. The probe revisit, we published the report. They said number of teachers up, classrooms has gone up, toilets in schools has gone up, buildings have gone up, number of primary schools and middle schools has gone up. But the classroom process has remained unchanged. Within the classroom, when the investigator reached the school, it was the same scenario 10 years later. Nothing had changed. It was again the same scenario of 4 teachers sitting outside on the veranda chatting, children left to themselves to do their learning. Now, why did we not address this evidence more effectively? Now, when you start looking into it, and this is again an area where I'm glad institutions like the Azim Premji University have chosen to work on this area. See, with a lot of fanfare, with the 1986 new education policy, institutions in the central sector called the District Institutes of Education and Training, DIETs, were set up. The guidelines for DIETs, they wanted the best faculty, the best professors, the best lecturers. These were all institutions which had to have 18 acres of land. Naturally, many of them were not available even in district towns. They had to be in remote areas. Now, in most of the states, the effort to recruit the best for these institutions failed because either people were not willing to go or governments were unwilling to recruit new people for these institutions. As a consequence, they became the dumping ground of officers of education service who were not wanted anywhere else. Send them to training institutions. Contrary to the Indian Army, where the best go as instructors in training schools, in a key sector like education, the district institutes of education and training from across the country, almost across the states, were in a state of crisis. Either they didn't have adequate faculty, or they didn't have the right faculty, or they didn't have the right provisions to get the right faculty. Now, how come this continued for so many years when our quest for universal elementary education, quality education? Now, I think when you analyze a lot of this, now this required a different way of crafting a credible training institution. The challenge here that it could not be done routinely, because you can't have mediocrity in a training institution. If I go to a training institution and learn little, it's of no value. Now, the challenge in crafting teacher training institutions and subsequently under the Sarva Shiksha Abhiyan, block resource centers and cluster resource centers also came in. Instead of trying to look at the entire teacher development agenda organically, linking up the institutions at various levels, we kept trying a hit and run. Maybe CRCs will do this, maybe BRCs will do it. So state after state kept trying to appoint more teachers, build more classrooms, but fundamentally could not alter the practices within the classroom. No rocket science. It's possible to be done. Countries have demonstrated that it's possible to be done. Countries after countries. Similarly, the example of nutrition. I raise the issue of nutrition because in many public fora, Honorable Prime Minister, the Independence Day address 3 years ago, talked about what a national shame it was to have the levels of undernutrition like India. If children don't learn in school, rest assured, large percentage is also because undernutrition in the 6 to 36 month period has irreversibly damaged their ability to learn. Other factors are there. Governance deficits are there, teacher development deficits are there, but nutrition deficits are also important. The problem when you try and analyze what is it that has gone wrong, on the one hand we see it as a national shame. On the other hand, even today, if all the blocks of the country, all the districts of the country, you will not find a single professional who understands nutrition, who is able to ensure proper measurements of ensuring that you are monitoring undernutrition carefully, who understand what wasting and stunting is about. The problem I particularly would like to elaborate just in a couple of minutes on nutrition, because to my mind, a lot of the challenges of inclusive development, education, health, has a lot to do with what we do on nutrition. Again, it is no rocket science. There is enough evidence. China is a very good example. China between 1949 and 1979 substantially reduced morbidity, mortality, undernutrition. What has it done in that period? Nothing very great. 5 things, very simple things. Clean water, food security, basic public health measures like immunization, public health campaigns around certain themes, whether it was mosquitoes or rodents or whatever. And 5th, a barefoot doctor in every village to do all the 4 above. Who was this barefoot doctor? It was like the quacks we have in our own villages. They were given a time frame. If you want to continue with medical practice, you better do this 18-month course, otherwise you will be in jail. A one-time decision that, look, if you want to continue as a barefoot doctor, you please do this 18-month course, otherwise stop practicing medicine. Just these 5 very basic things. It is not that at that level of economic development, they could get piped water supply in every village. What did they do? Very carefully, they promoted the cultural habit of having green tea in each and every village. During this period, government itself stepped in to say, in each of your community learning centers in the village, let there be a stove with hot water, hot green tea, boiling all the time. A community practice, a cultural practice promoted to ensure that waterborne disease becomes free in that country. What China did between 49 and 79 is what India needs to do on public health. Whereas a lot of what India has been doing, China needs to do. China doesn't have modern medicine doctors like we have in our country. We are far ahead of China on that. So I think there's a lot of cross-learning we need to engage in. There's a lot of talk now about conditional cash transfers. Each time, any new plan, we have new ideas being thrown up every time. Bolsa Familia in Brazil has worked so well. Yes, it has. Why do we forget that Brazil was investing 8% of its GDP, public expenditure on health, and 4% on education, when it decided to put in a little more money of conditional cash transfer for the poor families which were still not sending children to schools or still not using public health facilities. The facilities were there. Cash transfers without facilities can never work, especially in education and health. We are given the example that Janani Suraksha Yojana. Yes, Janani Suraksha Yojana has brought women to hospitals. But are our hospitals fully equipped to ensure safe institutional deliveries? Have all the pre-antenatal checkups been gone through? The answer is no. Yes, they have come because of the conditional cash transfer, but then our public systems is still not fully equipped to handle the load which has come on them on account of cash transfers, the Janani Suraksha Yojana program. Similarly, I have nothing against non-governmental partnerships for improving public systems. We'll need large number of them. I had the privilege to be a member of the Universal Health Coverage Committee under Dr. Srinath Reddy recently. And one of the recommendations, among others that we worked on, that it was time that India really stepped up its investments on public expenditure on health and public health in particular. Because I think it's, the first thing which strikes any of us, and since Bangalore has a lot of global links, whenever you go westwards, the first thing which strikes you is the level of public hygiene. It is not that London was any different 200 years ago. It had its own filth, but then they've sorted out that filth. Public health as a discipline grew in a certain manner. Ultimately, the challenge of public health in India is much more water and sanitation than just antibiotics. We seem to be fighting the public health challenge with antibiotics rather than water and sanitation. Now, some of these fundamental issues need to be addressed effectively, and for doing this, what we really require is what I have often argued, and luckily in my own state of Bihar, our Honorable Chief Minister was gracious enough to accept this idea. See, nutrition, many of these initiatives don't lend themselves to narrow departmentalism. You need to create what I refer to as a human development platform. If India can have a Prime Minister's Economic Advisory Council it better have a Prime Minister's Human Development Council. Because there is one indicator which is putting us to a lot of shame, it is on human development. And as I said, a lot of the changes that we want on public management, public recruitment, has to be a partnership of national and state governments. When Brazil went in for universal education and universal health, provincial governments, local governments and national governments agreed on their financial expenditures for the next 30 years. In India, when we enacted the Right to Education Act 2009, we said financial responsibility is a shared responsibility of center and state. So that both of them can come out. One will say that we didn't get enough money, the other will say they didn't put in enough money. Now, if we are sure that this is an entitlement, it ought to be backed. If it's a legal framework, it ought to be backed in a certain way. The human development framework which government of Bihar has adopted, essentially what has happened is a cabinet committee on human development have been constituted called the Mission Manav Vikas. About 16 cabinet ministers are member of the Mission Manav Vikas. It has 3 responsibilities. The team is choosing about 16 to 18 indicators across water, sanitation, education, health, development of scheduled castes, scheduled tribes, women. And these 16 or 18 indicators which are critical to human development of the state shall be monitored by the cabinet committee. That is number 1. Number 2, departments have to come up with clear outcomes. Every year, what is it that will be achieved, which can be monitored. Third, wherever there are gaps in programs, there may be a central government program or a state government program, but there may still be gaps. Where will resources for the gaps come from? Essential idea is that over the next 10 years, whatever these 16 or 18 indicators, which include from age at marriage, because that's an issue in my state, to high fertility rates. Just as an example, when you think across the sectors with the linkages, then you have a very different perspective. I recall when the sample registration system from the Census of India came out with this data on fertility rates, very interestingly, we found that the fertility rate for a girl who's done class 12th, whether it is Bihar or UP or Madhya Pradesh or Kerala or Tamil Nadu, it is 1.7, 1.8. It is at a replacement level of fertility. 10th pass girls, it's about 2.0. Otherwise, Bihar's fertility rate is 3.6 as compared to 1.6 in Kerala. But when you look at the educated girls, class 12th pass, our Chief Minister happened to read this piece which I had done for the Business Standard, calling it the development as the best contraceptive. The immediate thing which happened thereafter was the next meeting, we were told, dekhiye, family planning programs are all right. The state government has embarked on a program of a higher secondary school in every Gram Panchayat. That if we can ensure that every girl, they've been given the bicycles, can we also ensure availability of higher secondary school in every Gram Panchayat? Our assessment is that the replacement level of 2.0, which could never have been reached only by family welfare measures, if we recognize the development as the best contraceptive option, we move much faster. Where entitlements and rights of every child, every citizen is honored as close to home as possible. It's a big challenge to set up 5,000 higher secondary schools, but this vision that every Gram Panchayat needs a higher secondary school from a state where resources are limited. As the Principal Secretary, my immediate response was, we'll need about 8,000 crores. The reply was, it's not for you to bother where the money comes from. We will get the money, but this is important, this ought to be done. I think this is the kind of clear commitments which we require on some of these key parameters. I'll be very happy if this book is seen in that context, essentially as contributing towards a debate on how we craft our country differently. Clearly, there is something going wrong. There's something going wrong, both in terms of entitlements of individuals, the conflicts, the challenges, the insecurity, women's issues, a whole lot of them. And unless and until we address these challenges in a human development lens, there are limits to where we will go. The book's argument is that we can be far ahead of China and Brazil that we keep comparing ourselves with, only if we address this issue more effectively. Resources would be required. We cannot keep making promises of universal health coverage without adequately providing for it. Mere increase of less than 1% GDP to a little more than 1% GDP over the last 5 or 6 years And when you look at the decline in the infant mortality rate, the death rate, the fertility rate, the change is discernible compared to the previous 5 years. A state like Bihar, 2003 to 2007, a 2-point decline on infant mortality rate. 2007 to 2011, a 14-point decline on infant mortality rate. Examples of this are many. Quite a few states, Tamil Nadu again, which was already doing very well, it has made very good use of the additional resources available under the health mission to strengthen its systems of delivery at the cutting edge level. The public health cadre was always there, but more autonomy to institutions and more service guarantees at the local level, quality of services. As a consequence, we find the decline in mortality rates in Tamil Nadu has been extremely significant, more significant than what it was in the past. The point to be made is mere provision of some additional resources for public systems, if it translates into better services, that itself provides evidence that public systems ought to be strengthened. Health, education, more so health and education, is a sector which doesn't lend itself to market principles very easily, given the fact that there is so much of information asymmetry. It doesn't mean that we don't need secondary and tertiary hospitals in the private sector. We still need them, because the kind of services that we need is manifold. But whether we need to go the Yashaswini kind of route through a trust mode, or whether we need to go in for an insurance company mode is again an issue that the UHC had looked at very carefully, and it had felt that the insurance company route of the Rashtriya Swasthya Bima Yojana may not be the best option available to us, because what is happening, as we are noticing, that there are these collusions which take place. Claims ratios suddenly shoot up. They shoot up to a level where subsequent premiums become extremely high. On the other hand, in the trust model of Yashaswini, which Devi Shetty and the team have been working on, there is no insurance company, there is a third-party administrator. There are these 300 private hospitals which provide fixed cost services to farmers. All the money gets spent on healthcare. In the insurance company model, on the other hand, the claims ratio vary from 30% in some districts to 600% in some other districts. So it has consequences of cost of care subsequently, quality of care, a whole lot of other issues. And last but not the least, in these sectors, whether it's education, health, nutrition, any of these sectors, the countervailing presence of a functional public system is our only guarantee to quality of services even in the private sector. In Tamil Nadu, if a private hospital doesn't give good services, the patient will go to a government hospital and get the surgery done. In Bihar or in UP, unfortunately, that option is not available in many places. A dingy, dark, dirty private nursing home will still be doing cesarean sections because people don't have an option. So the countervailing presence of a public system is equally important for cost and quality of care in the private sector. These are some of the issues that the book had looked at. Thank you very much for your time. Thanks.
Amarjeet. I guess we now can go in for some questions, and rather, would we need a mic for people to ask over? Yeah, that.
Very much, sir.
Yes.
Thank you very much, sir, for that very discerning talk. I have no question to ask, but I have one observation to make. And if you have something to say on that, I'll be very happy to hear that. You were talking about China between 49 to 79. There's one point I like to make. Between 49 and 79, the single-mindedness with which China decided to construct a nation was to be seen to be believed. If you were in China between 49 and 59, I won't go to 79, you really couldn't make out the difference between a man and a woman, because all of them were dressed alike in quilt suits with boyish haircuts. Now, the austerity was the main thing. You know, they had this concept of an austerity to be followed by everybody. Nobody could own a car in China. You could perhaps own a cycle, but there were not many cycles to come by. So if you were a foreigner and you had a cycle, you could sell a fortune for a cycle. You couldn't wear a belt with a steel buckle. The steel went to the state to be smelted for construction. I think the single-mindedness whether we are in 2013 or in 1949-79, is a factor I think we can learn a great deal about. I think the question is not, comparing India with Brazil or comparing China and say we are good in this, but they are better in that. They are good in this, but we are better than them. I think this must stop. I think we need to look at, rather than look at a whole lot of things that gets diluted, you need to take measures, maybe austere measures, but decide where you want to go. I think that is lacking in the present juncture. I make this observation.
Good evening, sir. Thank you for that wonderful talk. With regard to the ideas that you have propounded, I can see that there are a lot of brilliant ideas that come forward in our nation, either from the bureaucrats or from the private sector, with Azim Premji Foundation leading the way. What I would like to say is there's also a lot of work to be done, as you've clearly demonstrated. But a bridge between these two happens to be a political class which gets re-elected every 5 years. So they are looking at benefits that will translate to votes 5 years hence, which is not very easily found in primary education or something that is more long-term. Now, as a voting class, how do we make sure that this is incentivized, sir? How do we form this bridge?
So when you look at the cities also, there is a widening gap between the rich and the poor. The rich is getting more richer and richer. The poor is getting poorer and poorer and getting marginalized. So how do you address these issues?
I suggest that we field these two questions.
And in the education system, what I find is the BEO is the most corrupt person here. How do you address that? While answering that, if you can use the BEO as an example. That's a block education officer.
The present conventional system and non-conventional system, which is the best for a developing country like ours to go beyond corruption, to avoid corruption?
Instead of taking people at a much earlier age of 20-25 after graduation. Why not we have a system where people have to work and earn their living for 10 years or 15 years? And then they come to the government service because they have a much better exposure and a different type of experience when they come to the service.
And it should be skill oriented.
So there will be always a connection. We'll have to take a call. Would you like to take antacid and then do that, or would you like to address?
For these observations and questions, starting with the single-mindedness, austerity in China, 49 to 59. Yes, clearly there have been factors, but the inter-country comparisons not so much to really see what works and what doesn't, but more also to try and understand that after all these were not rocket science, these were possible. And that's why on undernutrition, for example, examples not only of China, Brazil, Thailand and Vietnam. Three countries, purposely I am naming them because Brazil again, it's large, its problems were no less than ours. How has it resolved some of these issues is relevant for us. It's relevant because one, it used a legal framework which it respected. Once universal primary education was a right, once universal primary health care was a right, the state was obliged to ensure that it fulfilled the obligations of the citizens. Two, Brazil's model again is a very interesting example of how the public system was strengthened. At the same time, the private sector was also co-opted into providing services for public systems. In a country like India, this argument has often rightly been made, given especially in the health sector, educated large number in health in particular, that there is a large private sector in health. Now, how does one involve the private sector in health to achieve certain public health goals is a challenge where we can learn a lot from Brazil. The case of Thailand, because very interestingly, over a period of 6 years, early 80s, it could have a drastic change in levels of undernutrition simply by ensuring a community worker for every 20 families. There was a community volunteer for every 20 families. That community volunteer even today doesn't get a remuneration, but the training and support system for these community volunteers is amazing. The right practice with some minor changes in the provisioning of systems, but much more the community volunteer working to ensure higher utilization of public services, working to ensure behavior change through effective communication, and that seems to have clinched it in Thailand. The case of Vietnam, very interestingly, how work on water and sanitation can have remarkable consequences on levels of undernutrition. A country which again has a lower per capita income than India, but a higher human development rank. This again, when we keep looking at the league tables every year, are we at 134th or 136th? But when we look at these lists, we also, it's a point worth pondering while looking at analyzing some of this data. Very interestingly, I thought, let me look at some of the erstwhile Soviet bloc countries, because I was trying to write about public systems. Is there any trend there? Very interestingly, a large number of erstwhile Soviet bloc countries, Poland, Hungary, all of them, they figure fairly high up on the HDR. Now, which again establishes the point that initial equalization of entitlements to food, water, basic education, thereafter opening of the economy, it does seem to bridge a lot of the hierarchies of gender, social and other gaps that we may have in societies. The second issue on the political class, I can only say that yes, while the political class is important, I was mentioning it at my Azim Premji University lecture today. Again, 2 or 3 very specific instances. We know of Naikar as the leader of the anti-Brahmin movement of Tamil Nadu. My last book that I worked on, 2005, India, Democracy and Well-Being, I was looking at the complete the speeches of Naikar. Interestingly, each and every speech of Naikar was punctuated, the first 2 lines, women of Tamil Nadu don't marry early. Women of constituency, and again the political class that you just mentioned, Tamil Nadu is a very interesting example where cutting across political parties, there were certain commitments. Kerala is again another example, whether it is LDF or UDF, basic services to citizens remain a priority. Himachal, primary schooling, whether it's a Congress government or a BJP government. I remember going as an election observer in Himachal in Kangra, and I was quite surprised that schools were disrupted only for one day, the day of the actual casting of vote. I said, other states, all teachers are on election duty, how do you manage it here? He said, if we put all the teachers on election duty, there will be a dharna in every village. We can't close the school. Now that is the societal commitment. The political class has realized that this is important for citizens, therefore necessarily it has to follow. The point about corruption and inequalities which get manifested in urban areas more pronouncedly than in rural. One chapter in the book has dealt with this issue on countries which have managed urbanization much better and what is it that has made a difference. The argument that I have tried to make in this book, it's not only about infrastructure. While the Jawaharlal Nehru Urban Renewal Mission, it advocates a large number of reforms so that local bodies, municipal bodies have more resources to do more of education, health and human development and other programs. But the core of its visibility lies still on the infrastructure, physical infrastructure development. The community organization in the urban areas is a bigger challenge because local bodies and their organization getting cluster level or getting slum level clusters to have a voice in decision making in urban areas has been an issue. You've also rightly raised the issue of corruption. Very clearly, today public system's biggest challenge is to be able to win the respect which it had at some point of time. There has been clearly an erosion of values in all walks of life, in all parts of the society, but more visibly seen in the decline of public systems in a number of states. The answer is not a very simple one. Which is the best way to handle it? The Right to Information Act has helped, but again, as I always believe, that it provides us a post-mortem of what went wrong. We need to do something before that as well, which ensures greater transparency in the decision-making process itself, which ensures that entitlements are so well defined, systems are so well laid out, protocols are so well publicly known, that any departures make news even before the damage is done. It's a challenge. That's why the discipline of public administration requires lot more work at the cutting edge level. Every country which has strong bureaucracies, they've always rejigged themselves over years, either through public service agreements or various forms in which they have come out with ways of ensuring entitlements of citizens, especially whether it's in fact most of the countries where public systems of public expenditures manage to play an important role. Very rightly, you've raised the issue of the block education officer. How does one tackle it? In fact, one very interesting experiment we are currently engaged in with the Azim Premji University in Bihar. Both the block education officers as also faculty members in teacher training institutions. We said, since we have the freedom to choose, we said we will go through about it in a very scientific manner. We said we want our teachers also to become faculty members of teacher training institutions, but how do we select them? First we said all teachers who have MA, MAd or basic qualifications who want to become trainers in teacher training institutions may apply. We got about 6,000 applications. We screened those applications and based on certain objective criteria, we finally shortlisted about 450 of them who we thought could become teachers in teacher training institutions, as teacher educators. Said no, we'll not take them like this. We got a full team from the Azim Premji Foundation, a 30-member team with psychometric experts, psychology, HR, all kinds of people who developed assessors from within the education team in Bihar as also their representatives. All these 400 odd teachers were put through an assessment process, at the end of which 52 of them were found to be very good to be posted as teacher educators. They are the ones who got posted. That same process we are doing for the block education officers. I know that we may have a situation where we don't have a block education for all the blocks. We may not be able to get that many willing to work on these standards. But what I find is, the moment you put somebody through an assessment process, whether or not you select that person, that itself is growth. Because you are communicating where the drawback lies. You are communicating where the knowledge, skill or attitude issues are, which need to be addressed. So from that point of view, recrafting of public systems, especially in institutions or key positions, ought to be done through a process which is transparent and through a process where, it cannot be that you can have good governance in X and bad governance in Y. When you want to run a system, good governance doesn't lend itself to narrow bits and pieces. I cannot have a system where I allow district education officers who are corrupt to become district education officers and then to expect that we'll get good results through that system. So I think this message ought to be very clear, that you cannot play around with the public system at some positions and points and then assume that it will still deliver services. It's not going to happen like that. So from that point of view, a lot of these skills of assessment are important even for public systems. The question with regard to conventional, non-conventional systems, which again has to do with corruption, maybe the issue will get flagged again. If there are any other questions.
Okay.
I'll come to that.
Just
I think you almost half answered my question, but still I'll bring it up. It's definitely to do with corruption. And when you spoke about people who are coming into the system, they need to have merit and they need to have skill. What they also bring into the system is an ideology. And here I'm being extreme, but I think it's important for me to be extreme to impress upon everyone the importance of corruption is that they bring in an ideology of corruption with them. And here I would like to refer to Sir's idea when he was talking about the measures of austerity which were being taken by the country people. I think that is the ideology of corruption needs to be replaced with a similar ideology of austerity in order for the system to function. For example, Narega, when Narega started out as a down-top approach, it did function out really well. But the problem of corruption, the ideology of corruption, has in some way watered down the efforts being put into it. That was one of my observations, and I think you could give some of your point of view on this.
Very good, topics that you covered. But what about how does entrepreneurship leads to UNDP movement? And there are certain states which are doing better because regulation is lower there, but the states with permanent settlement, it's very hard to do entrepreneurship, business and stuff like that. As such, the education, my observation is, even if somebody is earning just 4,000 or 5,000 rupees, he wants his children to have the best education system. They'll try to send into an English medium school with 500 rupees as monthly fee, etc. So there is inherent interest in getting their kids educated. But large number of educated people, so-called graduates, are not able to do anything. They can't open a small business. They cannot, drive the business so that this becomes a movement. I would like to hear, thoughts on that, because I know states like Gujarat where general education level is not very, very high in terms of pedigree, but the business environment and there is a kind of a tradition there, while there could be MA, PhDs which are sitting, so things like that, sir. Your thoughts? Thank you.
1 minute. Where's this question coming from?
Yes.
Okay. So just hold on. After you, there were 2 hands that I saw. Once ma'am and okay. We'll take those 3 in a bunch, Amarjeet? Yes. Okay.
Lengthening, your view on the user fee. When I had seen a YouTube video, you have spoken against the user fee. In 87, the World Bank had proposed it as a specific measure for health system strengthening. So,
Here.
First, thank you for a very heartening presentation, which after 20 years of working in villages outside Karnataka, I did not think to hear. But I have to take exception or perhaps ask for more encouragement or more reason to believe, because you seem to be flying in the face of everything one has been watching happen. The dismantling, and sometimes at the risk of sounding paranoid, the deliberate dismantling of what used to be excellent public systems, and I'm predominantly interested in the healthcare system. The fact that even with our admittedly miserable allocations to health, if the existing systems functioned at even 50% of what they were capable of, we would be so far ahead. So what's the point of pouring more money into a system that's just leaking at every pore? We see it, there's World Bank money is going into the villages at Kanakpura where I work. There are hospitals, there are rooms, there are wards, and they produce, as you said, they have people streaming in because of JSY, and there is no evidence to show that it's making the least bit of difference. In fact, some of us wonder whether it's not having a negative effect. So my concern is that if you have a bureaucracy that, forgive me, but seems for the largest part more concerned with defending the existing system rather than taking a good, hard, painful look at what's wrong and what can we do about it, that chooses to see the NGO sector or civil society as obstructionist and deliberately hostile, where are we going to go?
Okay, out there.
Very much, sir, for an enlightening talk. In fact, I am unfortunate to not attend the complete, but whatever I've got, there's a question. Since Bihar has been forerunner in many of the social changes movement all over the country, so my question is concerning with the state that what exactly is the message of Bihar to the nation in the domain of education as of now? Thank you.
Thanks a lot for those questions. And I did not answer your question where you had suggested that public recruitments or recruitment to public systems, if they were to happen after exposure to the larger employment opportunities in various sectors, then perhaps people will bring in a different set of values with them. At this stage, I can only remark that I have had the privilege of working at the Lal Bahadur Shastri Academy. We find that the average age of intake has changed over the years. Now, on an average, for men in particular, about age of 28 is the average at which they are making it to the civil services. And when we try and analyze, we find a lot of them have 5-6 years of exposure. Somebody has worked for the HDFC Bank, somebody has worked for the UTI, all kinds of places. Now, which is a better system of recruitment? I think the jury is still out, in the sense that there is this view which some people hold, that a lot of the knowledge, skills and attitudes that we talk about, and as a trainer I can say, especially on attitudes, the general view has been that the earlier you begin, the better it is. A lot of the attitudes can be shaped up much earlier, because the older it gets more difficult to work on attitudes. And as somebody who has seen about 20 batches of civil servants graduating from there, the younger batches, I find many of them are very good on knowledge and skills. Very, very good. Attitude is an issue on which we need to do much more work. And from that point of view, maybe recruiting very late to public systems, in all public systems, may not serve the purpose, and where you thought that experiences in other sectors may help. That is the negative side, that values are already so strongly ingrained that little can be done about it at a later age. Madam, I think you've raised a very, very important question, and that is what I began with, that how did I have the courage to talk about public systems as an option. Madam, very clearly, the book does not make a case for a moth-eaten public system. I have said this in the beginning, I repeat it again. By that what I mean, you have to give it a fair trial. My argument is that we've never given it a fair trial. Not only in terms of financial resources, but also in terms of a lot of devolution, a lot of institution-specific decision-making that we are talking about. The point that I have also tried to make, and in the chapter on partnerships, for example, in particular, I have discussed a large number of partnerships where public systems gain by partnerships with the civil society. Whether it is the Right to Food campaign and the work of Jean Drèze, Aruna Roy, others, whether it's RTI, at no point on deepening of democracy, the chapter on deepening on democracy again has said very clearly that public systems, if they have to succeed, they need to build the civil society partnerships more organically and integrally. It is not as an isolated system, responsible only to itself, accountable only to itself, but much more as a system which factors civil society more actively and organically, not only for its accountability framework, but also in the process of building capacities for delivery of quality services. From that point of view, the public system envisaged in this book clearly builds a case for partnerships with civil society organizations more systematically. The issue of user fee, I have had a chance to study this very carefully across about 40 different countries. And the answer to the user fee issue, the jury is still out. I can only say that there is more evidence against it than for it. The amount of money that we are able to garner through user fee is not large enough revenue to improve the quality of service delivery. One country which has resisted user fee very systematically is Sri Lanka, a small little country. It refused a lot of assistance from the World Bank because there was the conditionality of user fee. I think on user fee, again, as I said, the revenues that you garner through this process are not large enough to make a difference to the quality of services, whereas the exclusions that you enforce because of it may be more detrimental for public health issues. Having said that, there is still a case for autonomy of institutions, even from a financial perspective, to see the kind of resources that an institution, a health institution, gets and the kind of services it provides. Some kind of an audit of those services can bring in a lot of what user service fees were expected to do. The question about Bihar, which you have raised, see, I'd only say that on education, it's a difficult situation that the state faces. Difficult because it's a state of 10.38 crore people where roughly 58% are below age 25. It has a very large young population, perhaps one of the largest in the world. While it's a demographic dividend, it may be a disaster unless and until human development opportunities are provided as early as possible. The problem has been the issue of financial resources. Of the total 71,000 crores that the state spent in 2012-13, about 20,000 crores, which is about 15,000 crores, which is about 19.31% of the total state expenditure went into education. But even that is inadequate. A whole lot of additional expenditures are required to be able to meet the aspirations of the young generation. The state has recently, the legislature has approved the Private University Act. While a lot of effort is on improving the university system, subjecting all our institutions to NAC accreditation and the higher education sector, expanding higher secondary education in every Gram Panchayat, provision for primary elementary education as per right to education provisions within 1 kilometer of all habitations. But the amount of resource required for quality education, that's why the government, after a lot of consideration, decided to go in for the Private University Act. And I'm happy to say that most of the leading private universities are also willing to come and work in the state. Again, we realize the countervailing presence of good government institutions are also important. Over the last 6-7 years, some very good institutions have come to the state. It has a very good national law school now. It has a good IIT which has come up. It has a good institute of management which has been having a record of 100% placement over the last 3 years, the Chandragupta Institute of Management. And mind you, many of these institutions have come up entirely from state plan resources. The Chanakya Law School, the Chandragupta Institute of Management, the Aryabhat University, NIIT, IIT, AIMS, Patna, quite a few institutions have started coming. And again, I think one of the strengths which Bihar has, a lot of its citizens out-migrated and are working in different parts of India and the world. Many of them are getting linked to the state again. When recently we recruited assistant professors in our medical college, and a very large number of people from very good institutions from across the country, Nimhans, Bangalore, PGI, Chandigarh, they have chosen to come back to the state and work there. We are hoping that more of them come and work in because we've just advertised, we're going to be advertising for about 3,000 assistant professors in our universities. And again, we've said we'll go by the UGC regulation. They have to be net qualified, and UGC regulation, PhDs only will be recognized. Which we are hoping to be able to get the best through some of these processes, because we really have the freedom to lay down norms and guidelines which are in the interest of the state and quality. So we are hoping for the best. It is a long haul, but I am certain that given the clear commitments for human development, I mentioned about the Human Development Mission, I am certain that in the years to come, we will have good results. The infant mortality rate I was mentioning about, we are already at the national average level, better than Rajasthan, Madhya Pradesh, UP and many other states. Death rates in Bihar are lower than the national average. And immunization levels, we were at 18% in 2005-06. I am happy to report by any external assessment, we are at more than 72-73% now. So again, it is no rocket science. If there is a clear commitment of governments to these, it's possible to achieve them. And I am certain in the years to come, health and education, Bihar will have better results. Thank you.
So what about
Excuse me, sorry.
It's already.
I think it's one, because I was not able to fully comprehend your question, because corruption, what is non-conventional corruption and conventional? Okay.
Corruption is over, you have answered it.
Okay.
Conventional or non-conventional, for a developing country like India, why don't we think of a non-conventional education with skill-oriented?
Okay.
What's your comment on that?
In fact, no, thank you for raising this issue, but the Gandhian schools that we want to revive now, Zakir Husain's Nai Talim and everything, they have to be seen in a modern lens. In our own state of Bihar, 391 of these Gandhian schools, we are trying to rejig them and make them into modern centers where the point that you are making is that physical development and mental development, there ought to be a relationship. Greater respect for work. Education for life rather than only for employment. Many of these principles hold true even now, but they all have to pass muster within a framework of a modern education system. To that extent, what is non-conventional ought to become mainstream. And I think...
to come out of corruption, don't you think this is the best? To the need of our country.
Surely, I mean,
Because education has fully become commercialized. We got to come out
So,
of it.
1 minute. So, can I, as moderator, come in here because this could go on, okay? And it's past 7th. No, 1 minute.
That's the large question.
Yeah, I know, but I have seen that you will take it and have a nice debate. I suggest that after this meeting is over, you can buttonhole Amarjeet and have a conversation. Not fair because I see this gentleman waiting with questions. It's past 7:30, it's 7:35 in fact. So if you don't mind, we'll take one bunch of questions here and wind up.
These are not exactly questions, but some doubts that I have in my mind from a very long time. Firstly, what people mean by the change in education delivery system in India? Is it merely the use of technology? Because that is what I mostly hear from everyone. If it is merely that, then we see the systems in US and Europe in the longer term have failed. We see Europe is having an unemployment rate of about close to 12%. Nations like Greece, etc., are having unemployment rates of 25% and so on. The statistics say that. Even in US, though they spend so much on education and healthcare, it is kind of affecting their economy, and today US grows at just about 1%. So maybe we may see such effects on India as well. While companies like Google and Apple have been able to do something, good websites like Wikipedia are again out of cash and they are asking for donations. So are we headed towards something like that in India if we concentrate too much on technology delivered education? Secondly, I am a very strong believer in chalk and board technology, because I'm sure we all have learned through chalk and board only, and I personally believe that what we learn through that system stays in our mind for a longer time than what we see through CDs, computers, videos, or any other technology. Another point that I just want to tell is we speak so much about education and ensuring that we achieve 100% literacy rate. NGOs say that they need about 2,100 rupees per annum per student to educate them. So what is the big fuss in this? Why are we lagging so behind? Even maybe we are doing the Rashtriya Shiksha Abhiyan, etc. from last 10 years. It doesn't cost so much, right? So what exactly is holding us behind?
Thank you very much and congratulate you. It's very difficult to see these days, in the last 20 years, to see somebody who appreciates the public service institutions, etc., etc. You have done it very well. Thank you very much. I agree that no comparison should be done at all on anything. Yet, if I look at India today, I want to make one comparison. Where do we begin if we want to have a new country? On one side, we have 100 million children in this country who are child laborers, branded as child laborers. They survive on 3 rupees a day. 100 million children. Okay? And then I ask you, where do we begin? I would like, we should begin from Delhi with a cultural revolution. There is one man sitting in Delhi who is planning for the entire country, and how much he spends on himself every day. I know you got the message whom I'm talking about. $4,000 he spends on himself every day when he leaves India. And he is planning for the whole country. And 5 million child prostitutes are in this country, girls prostitutes in this country. So this is a kind of comparison I would like to make in the country, not with outside country. The gentleman said very well, there was single-minded 30 years of construction of China. Therefore, today China can stand in the world. So we look at all these things together. Thank you very much.
Interesting talks. I've enjoyed listening. I just wanted to ask about, does Bihar, the state of Bihar, have systems for yoga training and teaching in the school curriculum both in the primary school as well as secondary school, as well as, do you see introduction of yoga as a way of protecting populations from, or helping them to stay healthy as a preventive wellness initiative? One more suggestion I wanted to make is in the government, in all the government offices in Bihar, if promotion of plant-based foods is given a priority, it could, especially low fat, it could really bring down the, along with yoga, it could really bring down the levels or the incidence of chronic non-communicable illnesses like the cardiovascular illnesses as well as diabetes and obesity.
Thank you for vision and health. We need to do much more systematically on yoga in schools, but at the moment we are engaged in something more exciting. All the 10 lakh girls in our middle schools and high schools in our state, especially in the context of a lot of security issues, all of them are being trained for judo, karate and taekwondo. We've got, because, and I can tell you it is, besides the cycle, it's a very pleasant sight traveling in rural Bihar to find 20 girls cycling to school together. The collectives of girls and adolescent girls emerging out of this, and with this judo karate program, we are finding great participation from them. They realize that real empowerment will come even through having better control on self-defense. Not that this is an answer to a lot of the problems, but I think both the points you've made are very relevant, and we'll try and work more systematically on that. Sir, to your questions and queries, little that I can say except that, yes, I think human development will have to become a societal mission. I think where we have failed is we compartmentalized human development to an extent where it became impossible to monitor where we were going. And I think other than being a societal mission, I don't see it going anywhere without that. And that's why, and I said, if we can have all kinds of arrangements for all kinds of things, from Economic Advisory Council to this, that, why not a clear human development trust with the civil society as an integral part of this entire approach? I think to your question, technology can never substitute the human element. And clearly, good teachers are human beings. Technology is only a means to that end. And from that point of view, I don't see that changing in spite of good nurses and good teachers. They will continue to be required. In fact, my personal assessment is that 2 decades from now, nurses and teachers from Bihar will be working in China. Given their current demographic situation, I think a lot of the young population from our country will be providing education and health services in many parts of the world in the decades to come. Thank you.
That's a nice note to end on. Thank you very much, Amarjeet, and thank you.